Thank you for talking to us today. Could you please tell me about the Holistic Cancer Care Review?
The idea behind the Holistic Cancer Care Review is that people are invited in between 4 and 6 months after a diagnosis to come in to speak to a practice nurse or the GP and have a chat about actually what matters to that person, and whether it be emotional, financial, psychological, and so forth.
So in a holistic review, you find out who do you live with? Who cares for you? Do they need help? Because that would have been a really important thing for my wife. My wife was working in a community pharmacy. She was looking after a 4-year-old and me, and it nearly broke her.
Actually, our patients tell us, and you have things like the patient experience survey that was carried out in Wales, that they feel that they would have wanted more involvement from their primary care services during their process of diagnosis and during their treatment. In primary care, both GPs, nurses and people in primary care, including the administrative staff and receptionists, for instance, what we are good at is that holistic care, looking at the whole picture and the whole person. And when we talk about cancer treatment, cancer care, there's still a person in the middle, and that is what we do.
Traditionally, cancer care reviews are done by the GPs, but they've sort of been it's been recognised that actually practice nurses can do them and probably do them better. So that's something that the programme is working on, training practice nurses across Wales to do cancer care reviews and to do them really well.
When I first started as a practice nurse in GP practice, and I went on a Macmillan course, and I went back to my GP practice and started doing holistic cancer care reviews, so inviting people in to talk to them about their cancer diagnosis. And I realised how fantastic it was, how much of an impact it was making for the person. I know as a practice nurse myself, in the past, I didn't talk to people about their cancer. I tended to avoid doing it because I didn't know where to start the conversations. And I suspected it might be the same for other practice nurses. So I then carried out a questionnaire to 45 practice nurses, and basically the responses I got back were saying yes, they tended to avoid talking to people about their cancer. Their confidence of talking to people about cancer was very low, and initially it was very difficult to get practices involved. Whereas now, when we put it out, the online course, we had over 100 people wanting to join. So the appetite has really, it's been fantastic to see how it has changed over the last 4 years, and the appetite for nurses and also for the GP practices to be involved. I did a pre and post questionnaire, and their confidence grew incredibly.
We've done a lot of work with holistic cancer care reviews, and some of the templates that we have highlighted to our professionals, they weren't aware what templates and resources and tools that were available. We have put together a little book, a practitioner's guide to cancer care reviews. And this is something that we have shared across Wales to all practice nurses. They didn't know that there were so many leaflets, resources available through Macmillan website. And that has opened a door for them, because this information and the leaflets are all free for cancer patients.
I think the programme has had a huge impact. I think the fact that we're multi-professionals working together is vital. I absolutely love it. I love making a difference on a more national scale, and I think that's a huge part of the programme.